Okay, welcome everyone. We're back. We're here in person. 3 years in the making. No mask. Everybody in the room. How about that? All right. So I'm Raj Mahajan. I'm an internist and geriatrician. I'm with an organization called SEMPAR. We work with Idph on their stewardship work that's mainly focused in the institutional or the nursing home and hospital setting. And thank you. Big thanks to Hectoin Institute for this great event. So it's here. Hashtag ISAS23. Please do that on your social media, and everybody welcome. So I'm going to head this morning session, the general session, and we just have this extreme honor to have Dr. Samir Vohra with us, the director in flesh here. Thank you for your time. Dr. Vohra is a pediatrician by trade and long history and policy and well known in the field. And I know it's a great honor to be asked to be in this position. So, and all the blood, the sweat, and everything else that goes into it. So we're not talking about that, but thank you. I think we in Illinois here have been blessed to have great directors through pandemic, and thank you for continuing the work. I'm not gonna say a lot, although I have already, but please welcome, share some thoughts, and thank you very much.
Well, thank you so much, Dr. Mahajan, and it's an absolute pleasure, to be in person and to talk about all aspects and not just one aspect of public health. And part of, I think, the great energy that I have gotten in this position almost a year in is to visit experts like all of you to talk about and understand how all of you are contributing to all of the detailed ways that we're trying to improve health in every corner of our state. Now, we're here today to talk about antibiotic stewardship, right? And nice to know that this place and even this conference cool enough to have this hashtag ISAS, which really sort of puts it in perspective of, you know, what we're trying to do and really sort of bring out a critical message about this work and how important it is for us to really speak about antimicrobial resistance, to talk about and educate each other, but educate the field around the critical nature of not just this being a problem today, but the potential of the growing problem moving forward. So this is a group of experts, but I think partly to kind of set the stage that we all know that antimicrobial resistance is an urgent global public health threat. It kills at least 1.27 million people worldwide and is associated with nearly 5 million deaths in 2019, according to a recent report in Lancet. In the US alone, more than 2.8 million antimicrobial resistant infections occur each year, and more than 35,000 people die as a result. And so we know it's an issue. We know it's a clear and important issue, and we know that it's also incredibly costly to our healthcare system. That the estimated national cost to just treat the 6 most common multi-drug resistant organisms frequently found in healthcare is $4.6 billion annually. And CDC showed recently as 2019 that more than 3 million Americans acquire Clostridium difficile, C. diff, right? One of the most common challenges that we face in all of our acute hospital settings and long-term care facilities. and that nearly 50,000 people die from these threats. And so with that as the issue, we know that we should, could, must do more. And how do we get there? And how do we create the type of efforts that we know are working? According to the CDC's AR Threats Report, we know that dedicated prevention and infection control efforts in the US reduce deaths from antimicrobial resistant infections by 18% overall and nearly 30% in hospitals. But just like much of health over the last 3 years, when we have all had to face a particular once in a generation pandemic, we've known that our challenges across almost each and every category that we've held as important has become increasingly challenged, and antimicrobial resistance is no exception. A special report in 2022 showed that in the US, much of that progress, those 18% reductions overall and nearly 30% in hospitals, had been lost in large part due to the pandemic. And the pandemic pushed healthcare facilities, health departments, and communities near their breaking points. And to continue this charge around antimicrobial resistance, it was difficult to maintain the continued practices, to keep the education up, to teach new providers, and to continue to follow those protocols when we know that all of you, healthcare heroes, public health heroes, were tasked every day to achieve the new and emerging challenges posed by the pandemic. And knowing that this was a challenge, one of the things that really came through more than anything around the pandemic was a statement for all of us that infection control and understanding that had to be a core tenet in what we talk about every single moment, not just in our healthcare facilities and our long-term care facilities, but it needed to spread to being a part of our everyday lives. And that is something that we must continue to think about. We must think about those innovative strategies. We must think about the investments. And seeing this jam-packed agenda, where we're going to go through in this summit, and you're going to hear from experts all across the state that are thinking about ways to make this impact in a number of settings, right? And for all of you, seeing kind of the senses of people in this room, pharmacists, nurses, infection preventionists, physicians, dentists, public health professionals, to bring all of your experiences as you hear from our experts to really sort of set the stage about what we want the future of this field, both right now and moving forward, to be. How we take all of those important lessons that have been placed in front of us, knowing that all of your centers and the work and just the fact that you're here in person, you have elevated this topic in your centers to be of primary importance. What I want to relay from the Illinois Department of Public Health, and especially our Department of Patient Safety and Quality, is that this is a critical issue in the department, and one that we have tried to work through, and you'll hear more from Jamie Jacob in a bit to really talk about many of those activities that are going on in the department. But we have held this summit annually since 2013. We are increasingly trying to think about how we promote the communication elements of this topic. Of course, you know, on our own sort of big stages, But part of what has been a goal for us in the department, especially now, a little over a month after the end of the public health emergency, is to elevate these issues to say that the work that is happening in this room, that is public health. And that we need to kind of continue to say that all of these activities are critically important so that we can spread the messages so that people understand that public health is not just us addressing one particular respiratory disease, even though it was a respiratory disease that affected and challenged all of us for the past 3+ years, but it is the work that's happening in this room, that all of you are public health, and that we need to kind of continue those campaigns, our annual antibiotic awareness week, the regional conferences and virtual education, so that providers are continually thinking about these issues, bringing them up, changing their practices to make sure that they're following these techniques, that they prevent antimicrobial resistance today so it doesn't lead to the problem of tomorrow. And part of the essential role that all of you play in public health is one that really is trying to prevent the next big emergency as you handle the crisis of today. Right? That all of you in this room, you know, the incredibly scary acronym of multi-resistant, you know, drug-resistant organism, right? That XDRO, that really scary thing that we need to communicate to all of our providers and patients to understand that what you are using to manage your infection, that is a critical story in this room, but it's also part of the ownership that all of us as residents need to collectively take. And so I'm here to, one, just thank you. And thank you for all of your continued work in this field, but really also push this group to help us, right? Help us in government, help all of the providers to really kind of build the present and future that we need to create here around antimicrobial resistance, infection control. And I'll end with, and it feels only proper, right, in this being kind of the Illinois Summit, and a quote that I've been using quite a bit as of late, is that we're really at a time where we need to invent a future of public health. We need to invent a future here around antimicrobial resistance. And no one better to quote here than Abraham Lincoln in Illinois. And Abraham Lincoln says, well, the best way to predict the future is to create it. And I'm looking forward to all of the innovations that come from this room, really paving the way that we are creating the future that's necessary to improve the health of all of our residents, not just in Illinois, but using Illinois as an example of how we can improve it across the country. So thank you so much for your time. Thank you for the opportunity to come visit, to present before you. And I'm excited for all that's going to come from this conference moving forward. Thanks so much.